These are the different types of acne scars. So classifying acne scars is really important because it dictates on which treatment is going to be best for the acne scars. Okay, so I'm going to run you through. These are rolling acne scars. So you can see they've got a bit of a rolling texture there. So you can see there's a bit of a divot inside there. Now, these acne scars, they respond really well to a treatment called subcision, where we actually go under the skin and release some of those scar attachments. And that allows this part here to lift back up and be really nice and flat with the skin. These boxed car or box scars or boxcar scars, you can see they're like really punched out lesions there. So it looks like it's a little cookie cutter lesion there. They can respond slightly to subcision, but they're really good for things like CO2 lasers, so an intensive CO2 laser. And also ones that are really deep, you could do things like TCA cross, or you may even like do a punch excision where you actually remove that little hole in the skin and give it a little stitch close, and then the laser can resurface that afterwards. The next one are ice pick scars. So this looks like there's like a little stab with the ice pick, and these really only respond perfectly well to TCA cross. So TCA cross is trichloroacetic acid, and we get a little toothpick or we get a little tiny little syringe dropper, and we put the acid there in here, and it just ever so slightly coats that layer of the skin. It resurfaces that part of the skin and then allows this to heal upwards, because our goal with these is to flatten the skin. These hypertrophic scars here, that is where your body has caused an abnormal response to trauma. So typically what happens when we have a wound healing is that your body tells the skin, well, your skin tells itself that, hey, we need to heal, we need to create a lot of collagen. But what happens here is the body doesn't stop. So once it gets to here, it just keeps creating collagen, and that's why it's really raised. So you'll find that people with darker skin types, so your subcontinental, Middle Eastern, Mediterranean kind of skin types, and even your darker Fitzpatrick African skin types will tend to get more of this than others. And these kind of things can be treated really well with CO2 laser. And in really severe cases, you may need a steroid injection or something like that. So these are all the different types of acne scars, and I'll give you an idea of how we manipulate the treatment to suit our specific type of acne scar for you.